Hello?
Hi, Mrs. Chapman. My name's Kim.
Hi, nice to meet you.
I'm a home health nurse.
Okay, all right. Well, come on in.
All right, thank you.
I would introduce you to Mr. Chapman, but he's not feeling well, so I had him go take a nap.
Okay. Well, is it okay if we
Yeah,
just
of
chat
course,
for
yeah.
a few minutes? Okay.
Okay, so you want to know a little bit more about Mr. Chapman and myself?
That'd be great.
Well, we got married about 25 years ago. We actually wanted to honeymoon in Paris, but it was so expensive. So we settled on Louisiana.
Could I get you to tell me a little bit more about your medication, or his medications, and, you know, like, maybe what caused the recent hospital admission and...
Oh, you were talking about that kind of stuff. I'm sorry.
That's okay.
Yeah, I can definitely tell you. He was a diesel engine mechanic for about 20 years, but about 18 months ago he was in an accident, so he had to quit, and it's been tough ever since.
So what caused him to stop working?
Well, he had a cerebral aneurysm and spontaneous intracranial bleeds and a CVA. I'm not sure what all this means. It's pretty foreign to me, but, you know.
So he had a stroke?
Yeah, I think that's the terminology that the doctor used. Mm-hmm.
Can you tell me about, like, the procedures?
Well, they cut into his skull to relieve some pressure, and that's about all I know.
Okay, so he had a craniotomy?
Right, that's the word.
All right. So, are you the only caregiver that your husband currently has?
Well, I do have two children, a 24-year-old and a 27-year-old, and they do come around and help out every so often, but they have their own life and their own family, so it's a little bit difficult for them to get away, so I am pretty much the only one that takes care of him. So what happens is I'll take care of him throughout the day, and then when he goes, you know, sleep and things like that, I work part-time in an answering service in our county. It helps pay for the bills, and you know, until recently, until the accident, neither of us had medical insurance, and now he has Social Security and Medicaid to help out a little bit, so that's been nice, yeah.
Well, I am going to try and help you as much as I can. I'll be coming by weekly. Could we maybe go ahead and set up a time where I could come back and I could meet Mr. Chapman? And
Sure, I'll have him up and ready to meet you tomorrow if that's something that you could do.
Yeah, that looks good. I just want to make sure that you don't have any other questions before I go.
Well, I do have one, and it's slightly embarrassing. I mean, but I'll just go ahead and say it. It's been really hard. I'm exhausted. And, you know, not to be depressing or anything, but I was just wondering what you think, you know, the outcome would be. You know, should I expect worse? Should I expect something better to happen? I have no idea.
Well, I work with a lot of families who have had strokes, and you know, they have good days and they have bad days. So it's really hard to tell what your husband is going to, you know, go through, but I will be here to help you, and we can just take it day by day.
All right, well, that's the only question I had, but thank you so much for coming here and helping out. Really appreciate it.
No problem. I'll see you later. Hi. Are you Mrs. Chapman?
I am.
I am Dr. Short. Nice to meet you.
And I'm Tiffany. I'll be your nurse today.
All right. Is this Mr. Chapman?
Yeah, it is.
All right.
Hey, my name is Flynn Flash Foxtrot Marcus.
I'm Buttercup.
And we're the Pharmacology Nerds. And we're here to break it down
and make it simple.
So, Doctor, what is this that you're doing?
I'm just checking for Perla.
Perla! Pupils equal round and reactive light in combination. It's really important.
All right. So it looks like the stroke has affected the right side of his body. He has good, strong pulses. And his capillary refill is 2 to 3 seconds, so that's good. He has aphasic and he has dysphagia.
Aphasic. That means this poor guy has trouble speaking.
Dysphagia? That is difficulty swallowing.
Alright, so just looking through his chart, it looks like he does have chronic urinary retention, but he has a Foley catheter and it's in place. His urine is a good clear yellow. and his PEG tube looks good. It's intact and it's patent.
Okay. So what's a PEG tube?
Percutaneous endoscopic gastrostomy. What this does is it bypasses the gastrointestinal tract, the first portion of it.
Basically, it's a tube that is penetrated in the gastro-abdominal wall. Yeah, and we don't want to make him leak because
right.
he can choke. We don't want him to die. Yeah.
Very good.
So how is Mr. Chapman's vision and his hearing?
Well, I think they're pretty good. He doesn't wear a hearing aid and he doesn't wear glasses.
And right now he's incontinent of bowel.
So what does that mean?
Incontinence. Loss of regular bowel control.
Involuntary leaking and excretion for those who are affected. Yeah.
Very good, Jen. Very good.
Alright, Mr. Chapman has bilateral crackling in his lungs. It's worse in the lower left lung field. Do you have his vitals?
His temp is 97.6, pulse 104, which is indicative of tachycardia, respiration 16, blood pressure 108/66, hypotension, and oxygen saturation 94% room air.
Thank you. So, Mrs. Chapman, do you have any questions?
I do have quite a few, but I think my biggest one is if somebody could explain these medications to me because I don't understand them.
Amber, we don't want another heart attack. This medication will prevent it from happening.
Yes, it will.
This will widen up your vessels, allowing blood flow to the heart. It'll make it pump easier and better. But if your husband is taking Viagra, do not give it. Ask your doctor right away if he feels dizzy, headache. Fortas. Make sure to give 2 milligrams. This will work to kill bacteria and your pneumonia, but watch out for seizures, vomiting, and diarrhea. Make sure to give the full course. Bactrim DS. Suspension of 160 milligram over 800 milligrams. Activate. It is taken by nebulizer. It allows bronchodilation so he can breathe better. Zantac. This is to reduce the production of stomach acid. To prevent aspiration. Watch out for dizziness, constipation, and diarrhea, and vomiting. Make sure to follow doctor's prescription.